right, I want to start with a quick yes or no question. Do you think the bill as it stands currently in the House, and there are going to be possibly some tweaks in this Rules Committee hearing, these amendments, is it fixable to get enough votes in the Senate in its current format?
Yes.
Okay, so with that in mind, I want to talk through what some of your fellow GOP senators are saying about this. You heard, of course, your friend Mike Lee there. This is what he tweeted. I promised the people of Utah I would do everything I can to repeal Obamacare. The House bill does not do that. I am a no. Senator Tom Cotton, despite the proposed amendments, I still cannot support the House health care bill, nor would it pass the Senate. And Rand Paul, the House AHCA is still Obamacare light. I would be a no in the Senate, but I don't think it can pass the House. I stand with the Freedom Caucus. All right, you can't lose 3 votes and have this pass in the Senate, so how do you get to the math?
Right. Well, I mean, in the end, Shannon, it's a legislative process, and what you're seeing is how that it's not pretty sometimes, but it's sort of grinding it out. The House has to move it first. They've got to get the votes. They have to figure out how to get 218, or I think maybe the number is 216 now, in the House of Representatives. But when it comes over to the Senate, we'll have an opportunity to work on it. And, you know, there are a number of senators who have things that they think would improve the bill, that would help it pass in the Senate. So, you know, this is the beginning of a process, not the end of the process. And it's all about building that coalition, making it broad enough to where you get the necessary votes in the House and in the 50 votes in the Senate with Mike Pence in the chair, and then something that's signable by the president. So, you know, we got a long ways to go. We know that, but this is an important commitment that we made to the American people. And what we know is the status quo is unacceptable. The American people have made it very clear that the skyrocketing premiums and deductibles and co-pays and out-of-pocket costs, they can't live with that. They want us to do something about cost, and that's what we're doing.
And that's something that you all have campaigned on since 2010. There have been a number of elections. You now have the White House, the House, and the Senate. And yet still this, schism within the party about whether what you're doing is really what you promised. I mean, Representative Jim Jordan, obviously the conservative flank in the House, says success is not simply passing this bill. Success is actually changing the system in the way that we promised the American people to actually repeal, not make over health care or Obamacare, but to actually repeal this and replace it. So when you have House members not convinced that passing this bill is actually doing what you campaigned on, how do you square that?
Well, I think I agree with the sentiment that the goal in all this is to reduce costs and to get more of a free market economy, allow the forces of competition work, give people more choices. That drives down costs. That's where we want to get. That's the end state that we're headed toward. And obviously we have procedures that we have to deal with here to get a bill across the finish line through the House and through the Senate. And remember, this is a multi-pronged approach. We have this piece of legislation. There are actions that can be taken by the Secretary of Health and Human Services, and there will be a second legislative vehicle later this year that will address many of these issues as well. So what I think people have to understand is, yes, we want to get there. We made this commitment, and what we're focused on is what can we do that will reduce cost, create a more open, competitive market for health care insurance in this country, give people more choices and more options, and thereby get those costs down. That's the goal. And obviously we got people who are in different places, and I get that. You have 240 Republicans in the House and 52 in the Senate, all of whom have different ideas about how to get this done. But that's why we've got to stay focused. We have to get it across the finish line. We made that commitment to the American people, and it's a promise we need to honor.
Okay, let's talk about the fact that in 10 minutes you've got Judge Neil Gorsuch sitting down for another round of questions, the Supreme Court nominee. Democrats, and it looks like he's arriving there live, Democrats have said they're continually hinting at a filibuster, 60 votes. You would need 8 Democrats to come with you. GOP leadership says that he is going to get confirmed no matter what. Can you tell us, will they use the nuclear option to lower the votes to 51?
We will do what is necessary to confirm Judge Gorsuch on the Supreme Court. Yes, and by the way, I think the Democrats who are, trying to attack him, in my view, in the last couple of days of these hearings, they have not laid a glove on him. He's conducted himself in a masterful way, and he's going to get a vote in the United States Senate, an up and down vote, hopefully, and an affirmative one.
All right, Senator Thune, thank you very much for your time.